Thank you all for joining us. This is the Providing Access and Transforming Health PATH Initiative Capacity and Infrastructure Transition Expansion and Development CITED Round 4 Application Informational Session. I know that is a mouthful, so for the remainder of this presentation, we will just be referring to it as PATH CITED or just simply CITED. Some of the goals for today are to do a welcome, go over the goals, talk about the PATH initiative as a whole, talk about the CITED funding opportunity that has opened as of yesterday, talk a little bit about the application process, so how do you complete that application, and some really helpful tips and tricks to completing the application, as well as doing a walkthrough of the application portal. And then we will discuss next steps for you all as it pertains to the PATH CITED application period. A couple of introductions. So my name is Katie Thomas. I'm the CITED Initiative Lead with Public Consulting Group. You'll hear us referred to as PCG. We are the third-party administrator of the PATH Initiative. I'm joined by my colleagues Oliver Dibb, our grant review team lead, Shannon Weaver, my other initiative lead, as well as Allison, who is our grant review support specialist. We are also joined by multiple folks from DHCS in the Managed Care Quality and Monitoring Division. Just to name a couple, we have Michael Fieser, who is the Chief of the Managed Care Program Oversight Branch, Shell Wong, who is the Chief of the Project Coordination Section, and Lisa Bistrop, who is the Chief of the PATH Unit. As well as many others I did not name, who are great, wonderful partners that we work with to go through the PATH CITED initiative. A couple of high-level things that PCG is responsible for as the third-party administrator. So we are responsible for designing and reviewing the application and all of the funding requests that will be submitted. We also market the opportunity to apply for CITED funds. We maintain public-facing documentation, such as the guidance document, our application walkthrough, our budget documents, and any other documents that are helpful to you to support your application development. We also collect and review progress reports for those folks that are awarded. We are also the fiscal administrator, so we are the pass-through agency in which you will receive funding through. We also troubleshoot issues and report on best practices and uses of CITED funding. Some of these goals for today are to understand the purpose of PATH CITED funding. What can you do with the funding? What is allowable? What is unallowable? How to apply? And answer some of those frequently asked questions. I'm going to go over the PATH initiative as a whole, very high level, brief overview. Some of you may already be engaged in other PATH initiatives, and that is great. We love to see folks utilizing all of the resources that are made available to you through the PATH initiative. So what is PATH? It is a 5-year, $1.8 billion investment to build the capacity and infrastructure of on-the-ground providers, such as community-based organizations, public hospitals, county agencies, tribes, tribal healthcare providers, and others to successfully implement ECM, or enhanced care management, and community support services, as well as launch justice-involved services under CalAIM. The key program initiatives fall into 4 different buckets, so I will not go too in-depth into CITED since that is the subject of today's webinar, but it is grant funding to support the development and expansion of ECM and community support services. Application windows have opened over multiple rounds that began in 2023 through 2025. 3 rounds of funding have been awarded to over 500 organizations for almost $600 million as of August last year. And the last round of funding, which we're here to discuss today, is now open and will close March 7th of 2025. We also have our Collaborative Planning and Implementation Initiative. Those are referred to as CPI. So they are collaborative planning and implementation groups that support and promote readiness for ECM and community support. You can register to apply at any point. It is ongoing. Those collaborative groups launched in January of 2023. They are regional collaboratives. So if you are a participant or would like to be a participant, you will participate in your regional group. We also have our technical assistance marketplace, or the TA marketplace. This is a shopping experience where technical assistance providers, we provide technical assistance to providers, community-based organizations, all of those that are eligible for CITED can also receive services through the TA marketplace. They help with planning to provide ECM and community support, TA recipient applications, project eligibility applications, and scope of work and budgets are open and reviewed on a rolling basis. So you can go on, shop the marketplace, look at some of the vendors, and do a project through the TA marketplace. It is free to the applying organization, so you are able to apply for a project and not be expected to provide any funding support. So as of January 2025, there are 557 approved TA recipients. There are 116 TA vendors and 875 executed TA projects that represents over $87 million in technical assistance provided to organizations throughout the state. We also have our Justice Involved Capacity Building Initiative, which is referred to as JI. So it is funding to support collaborative planning, infrastructure, and capacity needed to maintain and build out pre-release enrollment and suspension processes and implement pre-release services for the full suite of statewide CalAIM initiatives. So PATH JI Round 1 and Round 2 funding are closed, and Round 3 is open to targeted entities. So those entities are correctional facilities, jails, sheriff's offices, probation departments that provide juvenile services, as well as county behavioral health agencies. So that is the high-level overview of PATH program initiatives. But what we want to dig into a little bit deeper today is what is enhanced care management and what we call ECM, and how is that a part of CITED. So ECM is a Medi-Cal benefit that's available to eligible members that have complex needs. It is a part of the broader CalAIM population health management system designed through which ECM or MCPs offer care management interventions at different levels of intensity based on the member's need, with ECM as the highest intensity level. So when we're talking about ECM, we are talking about the highest level of need for that member. So ECM is high touch, and it is person-centered, where the member can receive comprehensive management of all of their health and health-related care, including physical, mental, dental care, and social services. One key piece of ECM is also that members have one lead care manager who meets them where they live, where they seek care, or where they prefer to access services, such as in their home, on the street, or at their doctor's office. Community support services are another set of services eligible to Medi-Cal members that will help improve their overall health by addressing those health-related social needs like housing, homelessness, medically appropriate meals, and other factors in people's lives that affect their health. So currently, there are 15 medically appropriate community supports that MCPs are encouraged to offer. Transitional rent is a new community support. This new community support will provide temporary rental assistance. It was very recently approved through the Centers for Medicare and Medicaid Services. And for this next section, I'm going to pass it over to my colleague, Shannon.
Thank you, Katie. We can go to the next slide. So as Katie previewed, the CITED initiative is one of the 4 PATH initiatives, and it provides support to organizations and providers who are establishing or expanding their capacity to provide ECM and community support services. This is the 4th and final round of funding for CITED, and the application window opened earlier this week and will be open until March 7th. Today, we're going to give an overview of this initiative and funding opportunity to help spread awareness and encourage eligible organizations to apply and prepare them for what to expect and what they'll need to do to apply. So just an overview of the timeline of the CITED initiative to date. There have been 3 funding rounds so far, including an additional CITED clinics round, which ran concurrently with round 3. On this slide, you can see some further details about each round, including the number of applications, the total funding requested, and how much funding was ultimately awarded. As you can see, there's been significant interest in previous rounds with applicants requesting significant amount of funding. And on this slide, you can see the distribution of all of the previous CITED rounds. This includes the CITED clinics round from round 3. And you can see that funding has been awarded to every county across the state. And the awards have been focused on filling enhanced care management and community supports gaps. One thing that we wanted to highlight today is our Pathways to Success website, which was launched in June of 2024. And this is a resource that you can use to find examples highlighting what previous awardees have used their CITED funding for to date. So we encourage all applicants to take a look at the Pathways to Success website for examples and highlights. On the website, we share stories from providers who are currently engaged in PATH initiatives that have helped them roll out or expand ECM or community supports and ultimately improve member care. Applicants can review these success stories for specific and concrete examples as they're thinking about what they may want to include in their project and how these funds can be used. These are just some examples and quotes highlighted from Pathways to Success. These one-time startup funds available from CITED have helped organizations expand their staff, their expertise, and their capacity to provide these impactful services. And many of these stories speak to how this funding has supported that necessary but difficult initial upfront investment that organizations need in things like training, staff, and systems to stand up these services. While we're still receiving submissions and success stories every day from different awardees and organizations across the PATH initiatives, some of the key themes that we heard and that we continue to hear is that these initiatives have helped them with their approach to member care, with improving their workforce, and in establishing key partnerships that are necessary to collaborate around providing these services and meet gaps and needs in communities. So looking at who qualifies for PATH cited funding, there are many different types of organizations who may be eligible to apply to receive funding. That includes counties and local governments, tribes and Indian healthcare providers, clinics, community-based organizations, just to name a few. All PATH cited applicants to be eligible must be expanding or developing their ECM or community supports capacity and service offerings, and they must have a signed contract with an MCP to provide ECM or community supports services, or an attestation indicating that the MCP intends to contract with that organization to provide ECM or community supports. There is more information interested entities can reference in the guidance document about the components and elements to include in attestations if you are submitting that to demonstrate eligibility. And I do want to note that hubs and subcontractors do have some additional requirements, and you should check out that guidance document for more information about what's required from those organization types. We also do have a comprehensive organization type definition list in the appendix of the guidance document. So turning to some of the allowable uses that folks can consider when they are putting together their proposed project and their budget for their funding request. PATH cited funding can be used for many things, including to support staff, either directly through salary support for key positions that are needed for ECM or community support services, or via expenses like training and recruitment. Cited funds can also support costs related to IT, data, referral, and reporting capacity building, and investments in those functions and tools and systems that are necessary. Cited can also support costs related to gap identification and developing the strategies that will be needed to roll out ECM and community supports to address identified gaps in your service area. And lastly, you can also use cited funding to support conducting outreach to potential Medi-Cal members to engage them in ECM or community support services. One thing that I want to call out and highlight for everybody is one key change in the round 4 cited funding opportunity is that projects will be limited to 1 year in the timeline. So applicants are not subject to a specific cap on the amount of funding that they can request in this round, but it is very helpful to keep that 1 year time frame in mind and what is feasible and realistic for your organization to be able to utilize all awarded funds and be ready to implement and execute all of the things that you're requesting in your budget. One helpful baseline for projects in previous rounds that have had a 2-year timeline, the average amount that has been approved and funded for awardees is about $1.1 million. So keep those things in mind when thinking about your proposed project and your budget. You really want to be cognizant of the timeline for this round 4 funding opportunity. Retroactive funding requests are allowable in cited round 4. So retroactive requests can be made dating back to January 2022. These requests are still subject to all of the normal guidelines for allowability. It must be an allowable use. It must fall within any time limit constraints that other funding requests are subject to, and it must meet our reasonableness guidelines and all of those things that are laid out in more detail in the guidance document. And for more information about retroactive funding requests specifically, you can find more information in that guidance document. Some of the minimum requirements that we'll be looking for all applicants to really demonstrate and make clear in their application is, ensuring that they have submitted a complete and clear application with all required documents included. Folks must be an organization that is in good standing, and they must show that their funding is aligned with cited goals and objectives, and that their requested budget is for things that are allowable, sustainable, and reasonable. All right, and then turning to the priorities for cited round 4, DHCS is considering data from several sources to inform the round 4 priorities, which continue to be aimed overall at filling gaps in service provision and provider capacity across the state. Some of the priorities include county-specific enhanced care management and community supports gaps that may differ by county. There are also statewide gaps that have been identified, so those are listed in the sub-bullet here. The birth equity population of focus and the justice involved population of focus for ECM, and then the new transitional rent community support service for community supports. Tribal and Indian healthcare providers continue to be a priority for round 4. as well as providers that are operating in rural counties or counties that have had lower funding, relatively speaking, in prior cited rounds. And then additional priorities include those entities that are serving individuals whose primary language isn't English, local CBOs, and counties, county organizations that are providing transitional rent. So some additional criteria and things that we're going to be reviewing applicants for and that you want to consider when developing your project proposal and your budget. Several additional factors we'll consider when evaluating applications. All applicants must demonstrate as a baseline that they are aligned with the broader cited funding objectives of increasing ECM and community supports capacity. The budgets will be evaluated for clarity, sustainability, and that they're providing all necessary details about what's being requested, and that they are within the reasonableness guidelines that are laid out in our guidance document. The review process is also aimed at equitably distributing these funds geographically across the state, so that's something that will be considered when looking across all of the applications. And we'll be evaluating how project proposals are aligned with the efforts of other key partners in their areas to meet identified gaps and align with efforts of MCPs, folks in collaboratives, and other partners in their community. And lastly, we'll be evaluating the extent to which the proposal will expand member access to ECM and community supports relative to other applicants and other projects that have been previously funded through CITED in the past. All right, and with that, I'm going to turn it over to Oliver.
Thank you, Shannon. All right, so I'm going to take you through a brief overview of the application process. So as you should hopefully already know, our application opened yesterday on January 6th. So the application is open and live at this time. And the application closes on March 7th, and that the application will automatically close. You will no longer be able to submit after 11:59 Pacific time on the 7th. To apply, you first need to go to our website, ca-path.com/cited. On there, you will see a blue apply button. Clicking that will take you to the Grants Connect webpage, where you will be prompted to start and complete your cited application. And I'll give a quick overview of what that looks like shortly. One note for this is the final round of cited funding. So I know that we have been talking about how there are a few differences for this round. It is just that year timeline, and this is the final round. So there will be no additional opportunities to apply for cited funding. So when you are preparing to apply, there are kind of 4 key considerations that we really strongly recommend applicants consider. The first is shovel readiness. And by this, we mean that there's only 1 year to spend funds for cited round 4. Given that this is a shorter time span, we really are looking for applicants to have thought through the process, be ready to implement and spend those funds, and have a very clear plan for how they're going to do that within 1 year. In addition to shovel readiness, we also want you to really think about organizational capacity. So consider your organization's capacity and resources. Who are the key staff who are going to support implementation? For the budget you're requesting, really think about how many staff you typically are able to hire during that 1 year. Think about what staff are needed to be able to do that. So we're really looking for in your application that you've considered your organizational capacity and that shovel readiness to do what you're requesting within that 1 year. Additionally, think about sustainability. So we really want the application to clearly demonstrate how you can ramp up your activities and sustain those positions and those activities after that year of cited funding. Um, Really, making sure that the request that, the staffing or the infrastructure that you are requesting can be supported by the new services you'll be able to bill for once you've ramped up those services through the year of cited funding. And then lastly, your community partners. Um, None of us can do what we're doing in a silo. We really want to make sure that you're working with different community partners to make sure you're aligning on gaps, working with your MCPs to establish referral pathways and other, partners who are out there in the community working towards the same goals that you are. So once you've kind of taken those initial considerations, it's really important to think about some of the key steps, both internally within your organization that you need to do to be prepared to apply for cited, and then externally. So internally, make sure you've discussed proposed plans with leadership and key staff to ensure buy-in, resource availability, and organizational readiness. Again, it is really important that you are ready to hit the ground running once, cited awards are announced, because you do have just that 1 year to implement. Obtain any leadership board approvals needed for the new positions or proposed expenses. And then make sure all plans are feasible, again, to implement in that 12 months. Consider how many full-time equivalents you can realistically hire and onboard in 1 year. So in addition to those internal conversations, it's really important that you're also having external conversations, making sure your project aligns with your community's gaps and needs. Are the, services that you're planning to implement or expand aligned with the gaps and the needs of your community? Coordinate with your partners, MCPs, collaboratives to align with existing efforts. This is a big one. Reach out to your MCPs as soon as possible if you are not already contracted. And even if you are already in talks of contracting, make sure you're reaching out and your MCPs and getting the needed documentation, those attestation letters if you're not already contracted. Those can often be some of the biggest barriers to getting your application in on time. So we really recommend you're having these conversations early. And then get quotes from vendors and make sure that you're, if there are things that you need a vendor for, that those timelines also align with that 1 year implementation. Okay. So if you need application technical assistance, first and foremost, we have our webinars. So we have the one going on today. There are additional webinars on how to improve your grant application. That's a 2-part series that we will be having. The first one is in mid-January and part 2 will be in early February. Those will dive much deeper into the specifics of writing a good grant for cited. We have our office hours. These are going to occur at minimum weekly throughout the application period once those webinars have been completed. All of these webinars and office hours, if you go to our website, you'll be able to get the links to register. Make sure you review all available application guidance materials. So we're going to have a slide that goes through all of the different materials in just a bit. We've also listed those as resources in this webinar, so you'll be able to see those. And then if you need additional assistance, please reach out to our TPA inbox at cited@ca-path.com with any additional questions. And so here are the helpful links for your round 4 application. So all of these are available on our PATH website and will be available linked here once the slide deck is posted. But we have our guidance document. We have our application PDF, so you can preview all of the questions. Funding request workbook, where you're going to input your budget. We have sample budgets. We have expanded these to includes some different types of applications, one for ECM and Community Supports, one specific to hubs, and one specific to rehabilitation. And then we have a Grants Connect FAQ that can help you troubleshoot any of your issues you're having with the actual online application within Grants Connect. Now, some tips. I'm going to go through these really quick. I'm going to be able to walk you through a couple of these when I go and do a demo of the application in Grants Connect, but anything with a red asterisk means they are required. And I'll show you if you don't fill those out, Grants Connect will give you a warning and won't let you submit until all required fields have been completed. Make sure you upload all required documentation needed to successfully complete the application. There are a few different places where you'll be prompted to upload documents. Make sure you read what is needed. Some of those might include your contracting documentation, so your contracts, your attestation letters. It may be documentation needed if you are a hub. There's some additional documentation needed there. And then in the budget section, for your funding request workbook and any additional supporting documentation, such as quotes or other things that you may have to support that budget request. And then lastly, confirm all contact information, understanding that if there's revisions needed or other things, you'll be contacted through the email listed there in your application. So making sure that you have all of those correct is very important. All right. So in the application, there are a couple questions that are specific to PATH CITED IGT. So I want to give just a quick overview of what this is. Entities that are specifically eligible for this CITED IGT are cities, counties, and other local government agencies and public hospitals. So to be eligible for CITED IGT, applicants must be able to contribute the non-federal share through intergovernmental transfer. So what does it mean to contribute that non-federal share? So that's saying that if you're awarded, applicants must be able to provide a 50% local match to receive funding for their approved budget items. So that means that if you are awarded $1,000 through CITED IGT, CITED will provide $50,000 of the federal funding, and then the awarded entity must be able to match that and provide the other $50,000. And so all contracting and payment related to IGT awards are processed directly with DHCS. And just to note that applicants are given equal consideration for CITED. So just because you may be an eligible entity doesn't mean you will be reviewed any different than other CITED applicants. All are given equal consideration for CITED. Applicants only awarded via CITED IGT are only awarded through via CITED IGT if they're not selected via CITED, and they indicate that their interest and an eligible organization. And if you mark in the application you're an eligible organization, it'll ask you if you are interested in pursuing IGT if you're not selected for CITED. All right, so what should you expect after you submit your application? So after you submit, you will not be able to revise your application unless you're specifically requested by DHCS or the third-party administrator. So please make sure that you have thoroughly double-checked everything before you submit. Once you submit, your point of contact and the TPA will receive confirmation email that the application has been submitted. Applications will be reviewed and evaluated by the third-party administrator according to criteria developed by DHCS. So once we have reviewed as a third-party administrator, we'll provide DHCS with our recommended applications for their approval, with DHCS making the final decisions for approval or denial of applications. Applicants will be notified of the decision via email to the point of contact in the application portal. So what happens after awards are announced? So after you get that notification email of your decision, right now that is tentatively set for fall 2025. Then awarded applicants will need to complete the contracting process with the TPA and the timeframe specified in the award notification. So that award letter email will provide all of the details for next steps and the timeframe. If you're not recommended for funding, you'll receive an email with an explanation of why sent by the TPA. So you'll have a brief explanation of why your application was not recommended for funding. So awarded applicants and progress reporting. So if you are chosen to be funded through CITED Round 4, once you're awarded, you will be required to submit quarterly progress reports. And these reports should detail your movement towards goals, any purchases made, challenges encountered, and milestones accomplished in the quarter. It's during the progress reporting process that awardees will create milestones tied to their budget items. And you will identify progress towards these milestones in that quarter. Take note on this that funds will only be distributed on completed milestones. It is not, funding is not provided for in-progress milestones. So right now, these are the tentative progress reporting timelines. We have the first reporting period will be for activities and milestones completed between October and December of 2025, with the first progress report due in January of 2026. And so then that table provides the 4 quarters. The reporting period is when activities will be done, and the report due date is when you'll have to submit your progress report. So once you've submitted your progress report on that due date, the TPA and DHCS have up to 45 business days from the close of the progress report to complete review and approval of the progress reports. And then once progress reports are approved by DHCS, funds will be dispersed based on those completed milestones that were approved by DHCS within an additional 45 business days. Right. So this is a sample of kind of what visually that means. So if your progress report window is open between October and November, so the progress report is due by mid-November, that's 21 days for you to complete your progress report. Then the third-party administrator has 30 calendar days to review. DHCS has 15 calendar days to review and approve. And then there's another 45 days in which funds will be dispersed. By the end of those 45 days, so by looks like mid-February, that is when funds would finally hit the awardee's bank account. So we just put this here to really make sure that when you're doing your application and thinking about shovel readiness and what your budget is, that you're thinking about, the fact that there is time between when activities are done and completed and when funds will be dispersed. Right. So now I'm going to take you just through a quick, very brief walkthrough of the application and what that looks like in Grants Connect. So bear with me for just a minute, and I will get my screen shared. All right. And so can everyone see my screen?
Yeah.
All right, wonderful. So this is what, when you click on that Apply Now button on our website, you'll be asked and routed here to Grants Connect. If you have already started an application and you've logged in now, you'll go to View My Applications. You'll be able to see your saved application there. If this is your first time in here for round 4, you'll be able to start a new application. I don't want to copy any. I'm going to go ahead and just start a new application. And give it just a minute. So, all right. So here is what you should see as you start your CITED Round 4 application. Here, and I'll just note before I start, The Tango walkthrough guide, that is part of our resource, is a walkthrough of exactly what I'm going to show you here as well. So if you want a refresher, that document is really, really good for walking you through steps on completing the application. So first, I'm going to highlight these tabs up here. This is one way to walk through the application. So this first tab, Introduction, provides you all of the very, very important information. Recommend reading it once, reading it twice, making sure that you have really understood what the instructions are saying. You can flip through the application via the tabs up there. Another way to navigate through the application is by scrolling down and hitting the next button. So now you're going to see, as I made a note of before, if you don't fill out the required fields, Grants Connect is going to tell you what your errors are. So if you go through and you fill out your application and you see it's not letting you sign and submit, you see this red circle with an exclamation point in it, you'll be able to come here and read through all the issues. So it's saying you need to enter for the organization's full name. That input is required. So it'll tell you what needs to be done. So this first tab is going to be basic demographic information of the organization. You'll be able to enter the organization's full legal name. Then you're going to enter the organization type. So there's a couple of kind of tips and tricks I want to note here. Your primary organization is going to be the main organization type that your organization identifies with. For this, you will only be able to choose one. So you may choose that you are an adult day health center. Note you can only choose one. You will also then be able to choose secondary organization types. So while the main organization type is an adult day health center, you may also identify as a community-based organization. You may also provide and identify as a behavioral health facility. So on your secondary organization types, you can select all that apply. If you only say really identify with one, the adult day health center, you can choose not applicable. But secondary organization types, you'll be able to choose as many as you see fit that apply. I'm also going to highlight, we tried to make and take some of your feedback from last round. One of those is providing some additional clear guidance on where things are in our guidance document. So we know that we provide a lot of guidance. That guidance document is quite long. So where we could, we've pulled out specific pages and areas of that guidance document where you'll be able to find specific information about organization types. So where we could, we have done that through the application. So again, this main page is going to be your demographic, your contact information, how long they've been in operation in California, and additional.
I'm going to jump in here. I have a feeling that Oliver maybe lost connection. I know I don't have to harp on it to this audience, but I know you all are experiencing some really significant weather issues. So I am going to jump in and take over for Oliver from here. And if he comes back, I'm sure he will take it right back. So give me one moment to pull up the application on my screen. Okay, yes, we have officially seen Oliver drop. So I will go ahead and share my screen. All right, hoping everybody can see that okay? Okay, great.
Yes.
So Oliver was talking about completing some of these demographic pieces of the application. So asking if it's a third-party representative, what's your organization's average annual operating budget. And we do just want to note that this is just gathering some demographic information. It does not have any impact on the applicant's overall score. It is for those informational purposes only. So I'm going to go ahead to the next page. So this page is really important. This is the page in which you will demonstrate your eligibility to receive PATH cited funding. So here is where you will provide all of your information about all of the MCP contracts that you maintain as it relates to cited. So it's going to ask you if you're fully contracted, if you're subcontracted with an organization, or if you are not contracted. It is okay if you're not contracted at the point in time of the application. We do just want to make sure that your intent is to be contracted by the end of the your project period. So we do ask for an attestation letter to attest that you have intent to get contracted with that MCP. So there are a bunch of questions about that. It will ask you how many MCP contracts you have. So one note I do want to call out specifically is that we really want to focus on the MCP contracts that you have or attestation letters that you have for those ECM and or community support services that you plan to provide or develop with those cited funds. So for example, if you are planning to expand to the justice involved population of focus with your cited funding, we do want to see an attestation letter or a contract that specifically says you are contracted to provide those services. There are a number of drop downs and questions and logic that will ask you. So if you're not currently contracted, why? Why are you not actively contracted? To explain your status. Are you in communication with the MCPs? As well as being able to upload those current contracts. I do see Oliver's on. Oliver, I can screen share if you'd like.
Perfect. Thank you so much.
Oh, Oliver, your audio is a little choppy. So I'll keep going. I'll keep going. So we also ask on this page, again, it doesn't necessarily impact your score or anything like that, but we do want to hear about your participation in other grant programs throughout the state, as well as your participation in previous PATH cited rounds, IPP, whole person care, the TA marketplace. So we just want to hear a little bit about that. And we want you to be able to tell us your plan for making sure there's no duplication or supplanting of funds between these other funding sources that you've already received. So just wanting to call that out as well. And then one other thing I wanted to call out at this stage is, have you requested the same budget items included in this application via any other pending funding sources? So if you have submitted an application to receive technical assistance via the TA marketplace, but you haven't been approved or denied yet, and you also include that piece of the project in your cited application, you can do that. However, it is your responsibility to make sure that as soon as you hear back from the TA marketplace, if you're approved, that you let us know so that those items can be taken out of your cited application. That also goes for IPP or DXF or any of those other funding sources that are out there. So please keep that in mind. And like Oliver pointed out earlier, there is here, see page 31 of the guidance document for additional details on how to handle this situation. On the next page is where we really start digging into those ECM and community support services that you plan to provide with your cited funding. So again, if you don't provide ECM, that's okay. If your whole project is focused on community supports, you can select not applicable. However, if you are planning to expand to adult nursing facility residents transitioning to the community or adult birth equity, go ahead and you can select all here that are applicable to your cited application. You will see that adult is separate from children and youth, so please keep that in mind as you're selecting. I'm going to select two more from the children and youth population of focus. So you can see that those that I selected up here have now populated boxes down here. I'll come back to that. Let's also say you plan to expand to recuperative care. So what we're asking you to do down here is estimate the amount of your funding that will be going to that ECM population of focus or to the community support service that you plan to provide. So I'm going to put 20 in all of these just to demonstrate that you want this total to equal 100. So you want to demonstrate all 100% of your funding is going to an ECM population of focus or a community support that you plan to expand or develop. We also have some questions down here asking how many Medi-Cal members your organization currently serves per year, and just your estimate of how many additional members that your organization can serve with your intended PATH cited funding. Oliver, I don't know if you have anything you want to add. I'll see if your audio is back up.
No, on that, just really it's your best estimate for the number of additional members. But no, I think you're covering everything very well. Thank you, Katie.
Moving on to the project description and justification tab. So this is the section that will hold your narrative questions, those that you will need to have responses prepared for. But it also continues to gather that information of where you plan to implement your ECM or community support services. So let's say you're expanding to Napa, you're expanding to a new population of focus in Napa, and you plan to open a new community support rehabilitation program in Inyo. So you will select the 2 counties that you plan to either expand or develop with your cited funding. And it's that same kind of boxes as it was on the last page as it related to adult, youth, and community support services. So you will also want this, and it'll give you that helpful hint here in red that you want the total to equal 100. So let's say that 70% of your budget is going to go to Inyo, then you would want your 30 to go to Napa. So again, you just want to make sure that those are totaling 100. And I think there's a really helpful example in here in the application. If you're requesting to hire 1 community health worker who will be based at a facility in Alameda County and 2 community health workers that will be based in a facility at Contra Costa County, you may want to estimate 35% going to Alameda and 65% going to Contra Costa because there are more staff. So theoretically, your budget would be going more so to that county. So keep that in mind as you're going through the application, that we are looking for those estimates of how much funding you anticipate going to each county. And again, here are those narrative questions. So please tell us a little bit about your project and how it relates to your budget. Describe how your organization's prepared to complete the budget and spend within 1 year. I know we keep reiterating that 1 year time frame, but we just want to make sure that everybody is well aware that this is a shorter implementation period than previous cited rounds and that you all are prepared to implement on a more expedited time frame. We also want to hear about how your organization will close gaps in ECM and community support services. Again, if you don't plan to provide or expand one of those services with your cited funding, you can put NA in those respective sections. We want to hear about your sustainability plan and also your organization's history working in the communities that you intend to serve. Again, this is just gathering some information, whether or not your organization is participating in a collaborative planning and implementation or CPI group. It's okay if you're not, but it is a really great opportunity to collaborate regionally with other organizations who are providing and developing their ECM and community support services. We also want to hear about how your funding is aligned with bold goals and have a little narrative question about that. You can select all that apply from the bold goals section. And then the last question on this page is about the population served by your organization. And then this is a very, very important page. This is the funding request page. So this is where you will download your funding request Excel workbook that is the workbook that you will complete as you're submitting your application. So we do need to see that specific workbook. It will also be helpful to you all because it shows you what we as the reviewers need to see in order to evaluate your application fully and fairly. So you will see little tips and tricks throughout here. So you can see reasonableness guidelines on page 17 of that guidance document. The sample budgets that Oliver mentioned earlier are also on the PATH CITED website. And then documentation requirements for retroactive funding is on page 13. So please make sure you're looking at those because those are really helpful as you're completing the budget. And then last but not least, we are going to be asking how many months are you requesting funding for CITED Round 4? Again, it's a drop down. You can request as little as a month, but up to 12 months. This piece is also very important. So as you are completing that Excel workbook, tab 4 is the summary. It will completely calculate for you. There is no need to manipulate any information or data on that tab 4. In row 5, it will calculate all of your budget items that you placed within your funding request workbook, as well as that 5% of indirect costs that are allowable to use through CITED. So that number that comes out in column B, row 5, you're going to want to directly copy right here. We want to see that the funding request in your workbook matches what you put in this application portal. So that's one really important piece. And then we're just asking what allowable use categories you're requesting in CITED Round 4. Those allowable use categories are more detailed in our guidance document, but it is also a drop down on the budget template. So you'll see as you're filling out your budget, if you select that you're going to be developing a plan to conduct outreach, that is something you select. So use that budget template as you're filling out this page of your application because you'll be able to see what allowable use categories you selected on your budget. And then, of course, do not forget to upload that budget when you get to this point. Make sure it's all completely filled out and that you'll be able to upload it here. And then the last page is just an attestation. You'll type your name and your title, and basically it's just saying that you will use the funding as intended and as appropriate. You will not duplicate or supplant funding from other grants or other covered Medi-Cal services, and all of those pretty standard attestations when you're completing an application. And then the very last, you will go ahead and hit that blue submit button down at the bottom, and your application will be officially submitted. Okay, Oliver, anything to add there before I turn back to the PowerPoint?
Oh, you did a great job. Thank you, Katie.
All right. Let me pull up the PowerPoint for you all. Can everybody see that? Perfect. All right. So as Oliver mentioned earlier, and I'm going to go kind of quickly through these last couple of slides just because I do recognize that we are at time, but I want to make sure you all get all of this information. This is being recorded, and we have the slides that will be posted to the website. So you will be able to reference these as you're completing your application. So there's a step-by-step walkthrough that Oliver talked about that is Tango. It will take you through every piece of the application as we just did in this informational session. It's just in a little bit more detail. And I want to conclude with some next steps. So the next steps for you all is to apply for funding. So you'll visit our website at ca-path.com/cited, find that blue apply button, and it will take you to Grants Connect. Highlighting again for everybody that the Round 4 application window did open yesterday. It is currently open and will remain open through March 7th at 11:59 p.m. Pacific. Oliver touched on these, however, want to let you all know additional informational opportunities, such as the How to Make Your Grant Application Stronger webinar series. That is 2 parts, occurring January 16th and February 3rd. And then we will be having twice weekly office hours beginning February 4th. So please visit our website for dates and registration links for those office hour sessions. Wrapping it up with some additional resources. I know there are so many helpful things and links as you're completing this application, but For any technical support or questions regarding applications, please email our cited@ca-path.com inbox, visit the PATH CITED website, visit the DHCS CalAIM webpage to hear about even more exciting things that DHCS is doing in the Medi-Cal space. The CITED Round 4 guidance document, if you read anything that we provide you, the guidance document is number one. It is really thorough. I know it's really long, but it is really helpful as you complete your application. We've also shared some gap filling plans that you may consider as you're filling out your application. And then collaborative planning and implementation, we mentioned that earlier, but please feel free to visit their webpage to be able to register for a collaborative. Here's some contact information. So highlighting that cited@ca-path.com is who you should reach out to. That is PCG, third-party administrator. We will be fielding application questions, technical concerns, and other items. The 1115 path at dhcs.ca.gov is a DHCS inbox. This phone number is our technical assistance hotline, so you can call in. An agent will pick up and speak to you about any of your application questions. And then, of course, we can't plug it enough, but the PATH CITED website that hosts a lot of our really great resources. Down at the very bottom of the page, you'll see resource materials or reference materials. I think only about 6 pull up at first, so you may have to click view more to get every resource that's available to you. So keep that in mind if you do visit the references section. And that concludes our webinar today. Please feel free to register for our upcoming informational webinars, as well as our office hours, and reach out with any technical assistance questions. Thank you all for attending.